All right, guys, so today we're talking about high definition liposuction. So what's the difference between regular liposuction and high definition liposuction? Well, regular liposuction involves removing fat, typically in unwanted areas, to improve the overall contour of that specific area. The process of liposuction involves using cannulas or rigid, hollow tubes to suction out the fat. Fluid is placed underneath the skin with medication that may include a local anesthetic with something called epinephrine to decrease the amount of bleeding associated with the procedure. Then fat is extracted with these rigid cannulas. Typically, the liposuction is performed by hand, and so it requires a little bit of work in order to remove the fat. Sometimes power-assisted devices can be used to help facilitate fat extraction and make the work of liposuction a little bit easier. Occasionally we use energy devices such as ultrasound, more commonly known as Vaser, to help also facilitate the removal of fat. High definition liposuction is very similar in principle to traditional liposuction, but the only difference is that in addition to just removing fat, we also utilize the relationship between the overlying fat and the underlying muscle in order to enhance muscular definition. So in preparation for high definition liposuction, it's very important that the surgeon understands where the anatomy is in a specific patient. And anatomy varies a little bit from patient to patient. So you actually have to have them stand and flex, and you got to feel the anatomy underneath the skin and the fat. And then you draw those areas out. You understand where the muscle is, where the divisions of the muscles are. And what you're trying to do is remove more fat in areas between muscle groups and remove less fat in areas over the actual muscle itself to create a three-dimensional effect to bring out the underlying muscular definition. So those concepts are very similar in both men and women, but obviously in men you're trying to create a little bit more definition because every guy wants a six-pack, but not every woman wants a six-pack. So you actually have to sit down and talk to patients about what their aesthetic goals are and how much definition they're interested in pursuing. Now, high definition liposuction is not for everyone. Not everyone is a candidate for it. Typically, the best candidates for these procedures are those people that are extremely fit, they work out, they have an extremely healthy diet and exercise habit, and they're able to maintain those high definition results long term. And so that's very important. Patient selection, or selecting the right person and making sure that they understand or in the right frame of mind in order to consistently take care of themselves after the procedure in order to optimize the result. So in addition, I always talk to patients about the possibility of fat grafting. So high definition liposuction creates three-dimensional effect of muscular definition, but it also, the concept involves using fat to enhance certain muscle groups in men. So for example, adding muscle to the deltoid in a man, adding muscle to the upper pec in a man to improve muscular definition and muscle bulk in the pectoralis major muscle, and also even considering adding fat grafting to the calf muscle in a man to add muscular bulk, as well as shaping the buttock of a man in order to create a more muscular looking buttock. In females, that may include fat grafting specifically to the buttock to create a more feminine looking buttock shape, to give an effective lifting effect to the buttock, and also to round out the buttock and to improve the overall shape of the buttock. Suctioning out the flank areas in both men and women are very important. In a man, suctioning out the flank or those stubborn rubber tire is important because it can create the V shape from the back, which every man desires, and also the V taper from the front. In a woman, that serves to create more of an ideal waist to hip ratio in order to create more of that hourglass shape. And so typically fat grafting is also considered when appropriate, and I always talk to patients about the possibility of fat grafting certain anatomic areas to enhance the overall high definition liposuction result. So that in a nutshell is high definition liposuction. The other important aspect of this is that the final result is highly dependent upon the surgeon. So the skill set of the surgeon understanding the artistic anatomy associated with the procedure, understanding what areas to fat graft are extremely important. Just because a surgeon has the right tools to perform this procedure does not necessarily mean you're going to have the best result with the procedure, because it has a high and very steep learning curve. So you want to make sure that you go to somebody who is experienced in this procedure and does this procedure well. How do you know if they're experienced or they do this procedure well? Look at their before and after pictures. and you'll get an idea if they know what they're doing. So a combination of somebody who knows how to do this, the combination of using the right tools and technologies, using the proper liposuction techniques and principles, using vaser ultrasound energy to deliver that, and also performing power-assisted liposuction, and knowing how to use all these techniques combined to create the best result is imperative to a really good result. And again, patient selection, finally. Making sure that you do these procedures on the right patients is also going to increase the chances you're going to have a really good result, because you can do this procedure, but if that person is not in the right mindset afterwards and they gain weight and they're yo-yoing diets and all that, the final result long-term is not going to be optimal. So thanks for tuning in, and hope you guys learned a little bit about high-definition liposuction.